is Dr. Manisha. I am working as a medical lead in Medical Affairs Division. Welcomes you all in this scientific session, generally organized for patient awareness for the patients who are suffering with PCOD and mental health diseases. On behalf of my division, I extend a warm welcome to all of you. And we are joining today with Dr. Swaroop Bhatnakar, who is a very well-known consultant psychiatrist and psychotherapist from Thane. Very welcome, ma'am, Dr. Swaroop.
Thank you so much.
Yes. Thank you, ma'am. So here, this session is mainly planned for our patients who are having some PCOD related disorder. So we all aware that this is very complex disorder that affects and impacts many aspects of patient's life, including the emotional aspects. So is it true, ma'am, PCOD affect mental health? And if yes, how generally it happens?
Yeah, absolutely true. Women actually are very much vulnerable to all kind of mental health issues, and obviously our hormones play a very important role here. Uh, we go through our monthly cycles. We go through pregnancy, postpartum period, breastfeeding, perimenopause, and menopause. At every stage of our life, we are actually very much vulnerable. So, this is very much, interlinked and interdependent on our neurochemicals in our brain, which are responsible for our mood, our thoughts, our behavior. Uh, as we all know that whenever we have our menses, okay, after the 5 days period gets over, there are two important hormones in females, that is estrogen and progesterone. So after the 5 days are over, the estrogen level starts increasing. Okay, the estrogen level increases because it has a very important role. That is to help the egg the to be released from the ovary. Okay, so what happens is that the estrogen level rises. Okay, and obviously there are other uh, hormones as well, the LH, luteinizing hormone as well. What happens is that estrogen has a very positive relationship with serotonin. That is a neurochemical that is responsible for our mood stability. That is why after the menses are over, when the serotonin level rises because of the estrogen level, which is also rising, a female feels very energetic. The mood is very nice. The sexual drive increases. There is a glow on our face, right? And around 12 to 14 day of the cycle, the ovulation happens, right? After the ovulation has happened, then the progesterone level rises, and the progesterone level rises because it is very important that if obviously conception if occurs, then the progesterone helps in increasing the lining of the uterus and also maintaining the lining of the uterus, so that if there is any conception, then the attached embryo can get the nutrients from the uterine wall. Uh, Unfortunately, progesterone is actually not very friendly with serotonin. So as the progesterone level rises, the serotonin level is, starts getting a little lower. So that is why what you can say that premenstrual uh, uh, dysphoria or irritability, that is around 1 week before the onset of menses, because of the peak level of progesterone that we have, right? That is why what happened is that a patient can have mood instability features, irritability, bloating, crying spells, sometimes insomnia, mood swings, lack of energy, drive, and motivation. And this is how, this happens. Now, even though a person may not have PCOS, and even though he has normal menstrual cycle, can go through this ups and downs of moods and insomnia, and irritability. Imagine a person with PCOS where this hormone balance is actually gone for a toss, right? They are going to have, obviously, the intensity of these premenstrual symptoms are going to be higher as compared to the other women who are menstruating. Also, because of the PCOS, as we all know, there is what you say, there is increase in the androgen levels right? So there is a lot of facial hair, there is a lot of body hair, then you have a lot of acne, your uh, there is hair loss and weight gain because of the insulin resistance. So obviously these females also have a lot of what you say body image issues as well, right? Because obviously it really changes the way you look, uh, obviously, which are considered as norms as a how a female should look, right? So that creates a lot of body image issues, confidence issues. Obviously, they, it makes them more vulnerable for anxiety disorder, depressive disorders, mood swings. So
Right.
yes, it is very much dependent.
So right, ma'am. Yes, I understand, like, it is a significant imbalance of various types of the hormones in women's health when the patient is affected with PCOS. But generally, it is very difficult to identify if the patient is having some mental health, signs and symptoms along with it. So it
Yes.
remains untreated. So
Hmm.
one of the factor is probably early detection of mental health, kind of disorder in such patients. So according to you, what are these common signs and symptoms which indicates that the patient should need help from mental health expert now? Or what are the common signs symptoms you can easily identify in patients?
It also depends on the severity of the PCOS. Okay, so there are criteria for diagnosing PCOS. So there is a difference between PCOS and PCOD. So
Right.
syndrome and disorder. So one is definitely menstrual irregularity. Okay. Another is because of the increased androgen levels, you have the other signs of, uh, acne. Then you have your, insulin resistance, hair thinning, then a lot of facial hair, bodily hair. And the third sign definitely is on the ultrasonography that you see a necklace, full necklace sign where you see a lot of follicles lined, in the ovary, and there is a bulky ovary, right? So that is the diagnostic criteria for PCOS. Now, a lot of women who are menstruating, but they are having irregular menses, usually they step up because uh, the menses are coming, so that relief is there. But some people who have a lot of unovulatory cycles, which is a very common finding in PCOS, they don't have menses at all. There is absolutely amenorrhea, and they really suffer a lot. Like you can see, absolutely they are having a lot of mood swings throughout the day. Maybe there's a constant bloating, insomnia. Uh, it could be, very lot of impulsive eating, binge eating, irritability, crying spells, sadness, lack of drive and motivation, not able to derive pleasure from the daily activity. So what, in my opinion, is that if you feel that you have PCOS and it is really, causing a very significant impairment in your daily functionality and your social life as well, then definitely you should seek help from a mental health professional. Okay, and obviously, uh, because it is very interlinked and interdependent. If you're stressed out, if you're not having a emotional well-being, it is going to have a counter effect on the hormonal levels as well. So your PCOS intensity is going to increase in severity if you are also not emotionally stable. So obviously they both go hand in hand. So it doesn't mean that you have to wait till you actually are suffering a lot till you seek mental health professional help. You can seek before also as a preventive measure so that it also helps in reducing the symptoms of the PCOS as well. So I think that is very important.
Right, ma'am. Here, so at the end, like, what is the management part? Like, is it possible to manage such patients with gynecological disorder, but having some mental health illnesses as well? So, how mental health expert can help regarding this?
Uh, I think it is very important. The liaison with the gynecologist is very important. So Unfortunately, not all PCOS patients are referred to us unless and until the gynecologist feel that it is really interfering in their treatment as well, or but here I think the family member also play a very important role. That if you feel that, especially in adolescents, right? Because there is a menarche, you have menses the first time, and then afterwards, maybe because of the hormonal imbalance, then the menstrual cycle go haywire, and then there is weight gain, then there's all other bodily image issues that start coming up with this teenager girls, and they're very much concerned and upset, and it really affects their social life. A lot of peer pressure as well. So they really suffer a lot. So I would really appeal to all the parents of all the adolescents, especially who have been diagnosed with PCOS, or even if you have not diagnosed them with PCOS, but they are having these symptoms like the menses are not regular, they have weight gain, you see acne, you see hair and everything, then it's better that you know, uh, seek help from the gynecologist as well as seek help from a mental health professional as well to understand and, you know, assess the mental health status of the uh, patient as well, right? So this is very important. I would really recommend that. I would appeal to all the parents of young teenager adolescents. If you see any signs of emerging PCOS, even though you have not diagnosed it, for example, there is sudden weight gain, there is a lot of binge eating, impulsive eating, then there is, thinning of the hair, acne, then there is, especially you have abdominal increase in the abdominal growth, and you can see uh, that the child is really suffering with a lot of body image issues. Menses are also very irregular. Seek help from the gynecologist as well as seek help from a mental health professional as well, because it is a very sensitive period for adolescents. So if there are any body image issues and because of the PCOS, they are having anxiety issues or depressive symptoms, then we can definitely intervene as early as possible. It also depends on the intensity of the symptoms, whether they are mild, moderate, or they are severe. Mild to moderate, yes, we can really work on the lifestyle changes, dietary management, exercise, counseling sessions to boost the confidence. And to be very honest, a lot of mothers come to us that there is so much weight gain, but still the child is not going for gymming or not doing any lifestyle changes, eating a lot. But they're not understanding it because of the hormone changes. There is lack of drive and motivation. Probably there could be underlying depressive symptoms which is not allowing the child, or the child is not having that motivation actually to work on the shortcomings that are actually a part of the PCOS package. So the mental health and the changes that you're expecting to happen in that child go hand in hand. So that is why help from a mental health professional really helps in also reducing the impact of the PCOS as well, right? And if obviously there is moderate to severe symptoms, it is very clinically significant, it is interfering in the daily functionality, and if nothing is helping, obviously we have to take help of the medications as well with a low dose um, antidepressants, and we can have various choices where we can make sure that there is no weight gain, there is no menstrual issues, and absolutely safe and tolerable. Obviously, for a very short period of time, and then you can taper it off and stop. If because of the menstrual irregularity, there is a lot of what we say mood swings or mood component, then we also have a lot of pharmacotherapy interventions and options available where we can even use mood stabilizers, where it can help in maintaining the mood stability as well. So there are many options available. The only criteria is seeking help at the right time.
Right, right. Thank you, ma'am. Very well said and rightly pointed out. So here we have reached at the end of this session. So before going ahead, I would like to give a note of thanks to you, because you might have come from your busy early morning, busy practice, came here and shared the knowledge, which is very important for our viewers also. And I'm sure that it is going to benefit our patients also who are going to view this video. Thank you very
Thank
much,
you so much.
Dr. Thank you so much.
Thank you.